Okay, look, thanks for coming, everyone. Today, the Department of Health is reporting 3 new cases of COVID-19. This brings the state's total number of cases to 31, with 6,582 Western Australians testing negative for COVID-19 to date. So 31 out of that number, as you'd understand, is a very good result for us to be in, given the current global spread of the virus. So in relation to those people, we have a male in his 30s who's travelled from UK, a male in his 50s who's travelled from Thailand, and a male in his 20s who's travelled from Ireland via Dubai. The flight numbers will be added online as soon as those details come to hand. So that takes to our numbers to 31, which means that, but still all from overseas sources. So at this stage, we can say there's still no community-based transmission of the virus in Western Australia, and that's a very good position for us to be in. I'd also just like to announce today that Bunbury Hospital COVID Clinic will be open as of Thursday. This clinic will be open between 10 and 4 each day to receive those COVID patients that meet the criteria around the national testing regimes. So just to remind you on what that is that they must have travelled from overseas in the last 14 days, and we will require some documents to show that they have travelled, that they are suffering from fever and or respiratory symptoms such as shortness of breath, cough or sore throat, and in addition to that, anyone who suffers from those conditions and has come in close contact with a confirmed case of COVID-19. As I announced yesterday, we have new protocols in relation to healthcare workers, and those protocols are being communicated through the health system as we speak. Just to recap in relation to that, that is those healthcare workers who have a fever and are suffering from an influenza-like illness. They'll be tested as part of a separate arrangement. Now, as announced yesterday, I have further details in relation to 3 of yesterday's cases who were healthcare workers who had recently returned from overseas. Before they came symptomatic, returned to the workplace. The department is now contact tracing any patients or staff members that they came in contact with, and once all close contacts have been notified, the Department of Health will release details to the extent we can while maintaining patient privacy. However, in the interim, I can confirm that they worked across 3 different areas of health, but not in general practice. I can also confirm that they were not public sector workers, and I've been advised that Ramsay Health Care, who run Joondalup Hospital, will be making a statement later today. I also announced yesterday that one of the recent COVID positive cases was hospitalised. That person remains in hospital in a stable condition. Over the last 2 to 3 weeks, you would have seen us making a number of announcements about our preparedness for the treatment phase. That is, for receiving those patients who are suffering from a respiratory illness as a result of the COVID-19 virus. I can advise that currently en route we have ventilators, humidifiers, life support machines and sensitive air filtering masks for ICU staff. Ventilators and humidifiers are vital to treat patients with severe respiratory conditions and will be essential in caring for WA's most seriously ill COVID-19 patients. We are essentially doubling our number of ICU beds. As a business as usual approach, we have about 127 ICU beds. We are procuring or bringing into service another 150 ventilators. So you can see we are tooling up significantly for the treatment phase when we get there. Also today, just providing further details in terms of our fast-tracking our recruitment drive in response to the COVID-19 pandemic. The WA Public Health System needs additional staff, as I've been saying, to increase our staffing pools and to reach out to those people who we can recruit to be part of our COVID response teams. You may have seen this ad in today's daily newspaper. In addition to that, we'll be undertaking advertisements in all online recruitment services and, of course, the usual healthcare networks to make sure that we get that message out loud and clear. If you're a doctor, if you're a nurse, if you're an allied health worker or someone who has a support role in the health system, we want to hear from you. We want to see if we can engage you further to help out when the COVID-19 virus takes hold, but also for those who may not be practicing in the system today, but who practicing certificates are up to date, we want to hear from you as well. We want to make sure that we expand our work pools so that when we do get into the grips of the COVID-19 virus, we have the work pools and the workforce to pull on to basically make sure that we can backfill in our hospitals, particularly in our regional centres, which of course have got much skinnier workforce penetration. I'd now just like to provide you with a further update in relation to the work from a public health risk perspective and invite Dr. Paul Armstrong, who has recently returned from Canberra in a range of discussions, to provide you with an update.
Thank you, Minister. So I've just returned from a meeting in Canberra of all of the communicable disease control heads around the country, as well as other experts. We discussed a range of issues, and some recommendations went to the Australian Health Protection Principal Committee, the Chief Health Officers of Australia, and again other experts. Some of the issues that we spoke about were the laboratory consumable shortages around the country, mass gatherings, how we protect our older people in aged care facilities, considering they're the most vulnerable group of all. We also spoke about school closures and the merits or otherwise of that, and also activities at the border. Now that we've introduced regulations that people have to stay in home isolation for 14 days, anybody arriving in the country has to stay in home isolation, we reconsidered whether we need to bolster what's happening in the borders for other countries that have got higher numbers of cases to add to our higher risk countries, which number of 4 at the moment. A lot of our cases at the moment are coming from the US and from the UK, but we know that there's a large increase in COVID-19 cases in Europe, right across Europe. So all of those recommendations will be considered by the Australian Health Protection Principal Committee, the Chief Health Officers. They met last night, late into the evening, and also all day today. So what is apparent is that we are on the cusp in this outbreak. We, at the moment, in Western Australia, have had no community transmission that we're aware of. It doesn't mean that it's not there. We just haven't detected it yet. I think that's a good thing, because it gives us time to prepare our systems. We can learn from what's happened in other countries that are more advanced in the epidemic than we are, and also learn what's happening in other states and territories. But we are on the cusp. We will get community transmission in the next couple of weeks, I would think, and we are just gearing up for that. Just on the topic of consumables for laboratory testing, that's a very important factor, because as we start to increase our surveillance across the community to detect other cases, we need to have testing capacity. What we've done in the last few days is to tighten up the criteria for people to be tested, and the laboratory, I'm happy to say, is up to date now with a short period of backlog. So we have gone from around 1,000 tests per day to around 500. And we know that those 500 people who are being tested are the ones that fit the case definition. So we've been successful in doing that. We've also been successful in sourcing some more consumables for the laboratory services. Now, we're by no means out of the woods yet, but that will shore up our ability to move into this next phase of the epidemic in this country.